In the world of EMS, there's a ton of acronyms, and we use them to make procedures easier to remember. The ones that are contained in this video are by no means an exhaustive list, and we're going to go through a few of the most common ones that you'll see and hear out there in the field. Our first acronym is BSI, and it stands for Body Substance Isolation. This is applied as a precaution for EMS providers to protect and isolate themselves from body substances that can be anything from blood to urine to feces, etc. And they're going to most likely come in contact with these things while giving medical treatment. BSI should be applied before every call, and it can include things like gloves, eye protection, face masks, full gowns, anything depending on the nature of the call. Our next acronym is ABCDE. After you've determined that the scene is safe, your first action of the physical assessment will be to check the A, B, C, D, and E's of your patient. This is an acronym that lists everything you need to do initially and maintain these things in order of importance. Our next acronym is SAMPLE. A sample history is an acronym for remembering questions that are important during your assessment of a patient. Let's go through the questions you should ask with each step of this process. For symptoms, we want to know what seems to be bothering you the most. Allergies is pretty simple. Are you allergic to anything? Medications. Do you currently take any medications? Past medical history. Do you have any current medical conditions? Last oral intake. When was the last time you ate or drank anything? What was it? And lastly, events preceding. What were you doing when you started having these symptoms? These questions can help you piece together a lot of the things that are going to be necessary for passing off to the hospital when you drop the patient off. Our next acronym is OpQrst. This acronym is often used in conjunction with SAMPLE as a guide for asking questions regarding a patient's symptoms, specifically pain during acute illnesses. Let's go over each question that needs to be asked when this acronym is being used. Onset. Did the pain start gradually or all of a sudden? Provocation. Does anything make the pain feel better or worse? Quality. Can you describe the pain? Radiate. Where is your pain? Does it go anywhere else in your body? And severity. How would you rate your pain on a scale of 1 to 10? And lastly, time. How long ago did you start feeling the pain? The next is the longest one, AEIOU-TIPS. This acronym lists the possible reasons someone might be unconscious or have an altered level of consciousness. It's important to remember this list so that you can begin trying to rule out each one as you do your assessment until you can find the cause and treat it. The next acronym is AVPU. It stands for Alert, Voice, Pain, and Unresponsive. This acronym is used as a tool to record and document a patient's responsiveness to determine their level of consciousness. The next acronym is Sludge, and that stands for salivation or drool, lacrimation or tears, urination, defecation, gastrointestinal distress, and emesis. Sludge is an acronym for the symptoms of discharge that occur with the parasympathetic nervous system when people experience drug overdoses or they ingest some sort of poison. Our next acronym is DCAP-BTLS. This stands for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. This acronym is used during the rapid head-to-toe assessment of trauma patients. Starting from the head, you will examine each part of the body looking for any of these signs. You're only going to stop and treat any of them if they are considered life-threatening. The last acronym we'll look at is SOAP. SOAP stands for Subjective, Objective, Assessment, and Plan. The SOAP acronym explains the format you need to write your pre-hospital care reports in. The subjective is what you were told. The objective is what you observed. The assessment is what you think the outcome is. And the plan is what you did. That's it for our EMS acronyms video. Thanks a bunch for watching.